Hi, everyone. This is Dr. Sonia McGowan with Covenant Chiropractic and Wellness. And today we're going to be talking about PANS and PANDAS. I'm going to give people just another minute or two to come on in and get settled, and then we will get started. In the meantime, if you have any questions, you can definitely put those in the chat box, and we'll hopefully have time to answer a few of those. We'll get started right at 10 o'clock. All right, so here we go. Welcome to everyone. I'm so happy that you're here and joining me today for our first in our webinar series. So today we are talking about PANS and PANDAS. This information is super pertinent right now. There are just so many families who are struggling with this diagnosis or suspicious that their child is experiencing this, and are struggling for some answers. So this I thought was apropos for our first in our webinar series. So let's talk about who I am and why you care to listen to me. So I am a chiropractor by education. My clinic is in Jefferson City. We specialize in complex kids. My own kid was a complex kid, and I deem him my first recovery story. So you can just see a little snapshot of my life here. My husband, Shannon, my daughter, Libby, my son, Rowan, and when he was little as well. So we're a pretty happy little family here in Jefferson City, Missouri. And I have spent my life working with kids with autism, kids with PANS, PANDAS, and other complex needs. And so that really is the focus at my clinic. All right, so today, what we're going to talk about. So PANS and PANDAS is an acronym. There are lots of other acronyms for this too, so I'm going to walk you through what those mean. We're going to talk about the diagnostic criteria and the symptoms. We're going to talk about some triggers, and then we're going to talk about what to do about it from a medical, more traditional standpoint, as well as an alternative standpoint as well. I will mention we do have a really hard out time limit. And so what I'm thinking is if we don't have enough time for questions, we may just schedule another webinar specifically for questions. So that's definitely a possibility. All right. So the acronyms, what does all of this stand for? So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is the same thing, except it's caused by strep. Some people may call it PITAND, which is Pediatric Infection Triggered Acute Neuropsychiatric Disorder, or CPIE, which is Childhood Post-Infectious Encephalitis. Honestly, I like that best because it speaks to the encephalitis, which we're going to talk about here shortly, but they didn't ask me. So, all right, so how does it all fit? So I want you to see this as an umbrella. So PANS is the umbrella, and underneath that we have infectious triggers and non-infectious triggers. So let's follow the slide on the left and go down the infectious trigger side. So if we have autoimmune encephalitis caused by an infectious trigger, and that infectious trigger is strep, we call it PANDAS. If it is an infectious trigger that is not strep, so let's say it's a virus, it's a different bacteria, it's Lyme, it's a parasite, it's Candida, then we call it PANS, right? So PANDAS only applies if it is caused by strep. Now, we can also have some non-infectious triggers. It's not as common, but it does happen. And these are environmental situations like toxins, heavy metals, chemicals, things like that. Okay, so PANS is not strep, PANDAS is strep. So this is a very commonly missed diagnosis. So over half of kids with PANS will be diagnosed and mistreated for over a year. And in the grand scheme of a child's life, a year is a really long time when they are struggling with the symptoms that we're going to talk about. And it's important that you understand that 65% of new strep infections cause no symptoms, but were immunologically significant. So PANDAS is so common in my clinic now that I, as a routine screening question, ask, have you ever had strep? Many families will say, no, they've never had a diagnosis of strep. And then when we test them, we find that, in fact, they did, and parents didn't know it. And so it's really, really common to see kids who had a strep infection with no symptoms. So very commonly misdiagnosed. Most of the time, the kids are misdiagnosed as having a psychiatric illness, a tic disorder or Tourette's syndrome, maybe OCD, ODD, oppositional defiant disorder, behavioral problems, and the really famous one is they're misdiagnosed, and we all know that's crazy. All right, so let's talk about symptoms of PANS and PANDAS. So PANS is a neuroinflammatory autoimmune encephalitis. Encephalitis means brain swelling. A diagnostic workup should be considered for any child who has a new onset of symptoms or in kids who have multiple current diagnoses. So if there's a child in your life who has a long list of diagnoses, we really need to take a second look at PANS and PANDAS. So let's talk about the actual diagnostic criteria. So for PANS, there needs to be an abrupt, dramatic onset or an abrupt recurrence of OCD, right? So some compulsive behavior, restrictive food intake, and then at least two in this list. So anxiety, emotional lability, so meaning their emotions are going up and down quickly, or depression, irritability, aggression, oppositional behaviors, any sort of behavioral or developmental regression, a deterioration of school performance, sensory or motor abnormalities. So this might look like a change in the way they walk, or suddenly they can't stand to hear people chew their food at the dinner table, right? So sensory amplification. Somatic signs and symptoms. So most commonly we see things like a new sleep disturbance. We'll see enuresis, so wetting the bed in a child who was previously potty trained, wetting their pants, soiling their pants, soiling the bed, and then a change in urine habits. So we'll see sometimes an increase in frequency or an increase in urinary volume as well. And so for PANS, you have to have those things, plus symptoms cannot be better explained by something else, okay? And with PANS, there's no age requirement, and this is different in between PANS and PANDAS. And so for PANDAS, what we're looking at then is a presence of significant obsessions, compulsions, or tics. So remember, obsessions are thoughts, compulsions are actions, and tics are uncontrollable vocal or motor movements. So sometimes we'll see things like we will see an abrupt onset of symptoms or a relapsing, remitting course of symptom severity. So parents will tell me just all of a sudden I had a different kid. And we'll see kids who relapse and remit. So they'll do better and then they'll backslide, and then they'll do better and they'll regress. For PANDAS, according to the literature, it needs to have an onset before puberty. That's tricky though, because sometimes with kids, it's a slower onset. Parents don't really realize what's happening, but when they look back, they can see that it was actually a fairly acute onset. And it needs to be associated with a strep infection and associated with other neuropsychiatric symptoms. All right, so let's talk about real life versus what the literature says, okay? If you're deep in the trenches with kids with PANS and PANDAS, you know that sometimes they don't follow the rules, right? Sometimes the way a kid presents isn't exactly what the literature says it should be. So it says it needs to be a sudden, acute, debilitating onset. But what I generally see is there can be a possible gradual onset, a slow onset, and sometimes that's because the child is able to compensate. So they're able to look like everything is okay when really it isn't. And the literature says it needs to be before puberty, the onset before puberty, but often it's actually after puberty, what I see in my clinical practice. We see lots of somatic findings. So I will have parents tell me the child had a sudden onset of clumsiness, a change in the way that the child walks. We'll also see that their pupils do not respond appropriately to light. We will also notice some differences in eye tracking. One of the common things that I see a lot is an onset of stuttering or other speech issues. So kids will just out of the blue start having fluency issues. And then we see changes in reflexes as well. So it's really common for me to see that their upper reflexes are normal and their lower body reflexes are hyporeflexive or some combination of that. So we had talked about a regression in academic skills. So it's very common for kids to have a regression in math and or handwriting. And so this is an example. So over here you can see that when a child is not in a PANDAS flare, their handwriting is lovely, but during a flare, their handwriting falls apart. And then over here, this is actually a patient of mine who has generally quite lovely handwriting, but when in a flare, the handwriting is still nice, but he writes over and over. Verbs actually is what he's compelled to write over and over on top of each other. All right, so in terms of triggers, let's talk about this. So strep by far is the most common trigger. And so we can have other triggers as well. Mycoplasma is a common one, as are viruses. So that could be influenza, Epstein-Barr virus, HHV6, herpes simplex virus, cytomegalovirus, or Coxsackie. And what we're noticing now in our present landscape is COVID can also be a trigger for PANS. We also see tooth and dental issues being a trigger for kids. So when we have kids who maybe get a wiggly tooth, a baby tooth getting ready to fall out, or a new adult tooth coming in, or maybe a vigorous cleaning or the placement of braces, then we will see that PANS or PANDAS symptoms will flare up. Klebsiella is another bacteria that we will see as a trigger, as well as mycotoxins, which are from mold. Yeast, parasites, and Lyme can all be triggers, as well as sinusitis and allergies. So a lot of times we'll see kids whose behavior really, really suffers during times of high pollen. All right, and so the incidence rate, literature says it's about 1 in 200 kids have PANDAS, but honestly, I think it's more. I think there are just so few doctors who are versed in PANS and PANDAS that I think it's quite underidentified. In terms of the age of onset, the average age of diagnosis is somewhere between 4 and 13 years. And a lot of people think you have to have a diagnosis of autism to have a diagnosis of PANDAS, and that absolutely is not true. They are standalone diagnoses. All right, so in terms of how we figure this out, so what are the labs that we do for this? What I notice is that these are families who are really struggling to get appropriate care for their child. They have trouble just getting their doctors to do basic labs for kids. So we will see that they can't even get a basic blood count or a vitamin D. And so I'm a big advocate that, despite their diagnoses, kids need just basic labs. Parents are often refused labs because their doctor says it's just autism or it's just whatever. And so what I always like to do in terms of basic labs includes a CBC, so a complete blood count, a metabolic panel, a vitamin D, a total cholesterol. It's really common for our kids to have low total cholesterol, and this can promote behaviors that can look very troubling. So we always want to make sure we look at cholesterol. I like to do a thyroid panel as well as a ferritin level as well. And then specific to strep, here is a list of the labs that are specific to strep bacteria. So we have ASO and anti-DNase. Some labs offer something called streptozyme. We will sometimes also do a rapid strep swab and or a throat, nasal, or rectal culture. And then if we're having trouble really nailing down what the issue is, what the pathogen is, sometimes I'll do a stool test as well. All right. And then I always, if I'm drawing blood, I always do a viral panel as well. And so this is the list of viruses that I tend to do. Coxsackie, a couple of different herpes viruses, Epstein-Barr, CMV, and Parvo B19. Those are all shown in the literature to be pretty significant triggers for PANS. And then, so the hardest part, well, one of the hardest parts about figuring out PANS and PANDAS is really dialing in and understanding what the trigger is. And so if we have ruled out strep, if we've ruled out viruses, we have to keep moving down the line, right? And so at that point, I like to look at Lyme and co-infections. I like to do a nasal swab for something called MARCoNS. That's an acronym, a really long one that basically stands for a certain sort of staph infection in the sinuses. This can also be a trigger. Sometimes we'll do some additional lab tests, the Cunningham panel or the neural zoomer. These are both really good tests that will give us a glimpse into potential pathogens and the presence of autoimmunity. All right. Now, when we're dealing with an infectious trigger, particularly if the trigger is strep, we want to make sure that everyone in the family is tested. So if other people in the family have strep, if they're a carrier, we have to know that, right? So that we can get the appropriate treatment for everyone. I have even seen where a child tests negative for strep, but someone in the family is a carrier. And when that child is in close proximity to that person, their behavior falls apart. So it has happened with multiple families. So it's important that we check the whole family. All right, so what do we do about this? The usual traditional treatment for any bacterial pathogen, of course, is antibiotics. And the literature tells us that prompt treatment with antibiotics eradicated OCD behavior and symptoms in 8 out of 12 kids with PANDAS. So as much as I'm not a fan of prescription medications, sometimes it's warranted. And in nearly every case of PANDAS, if a family wants to pursue antibiotics, I absolutely support them in that because the literature says it's a helpful thing. Sometimes steroids are helpful. Anti-inflammatories are necessary. One thing I don't agree with, though, is the tincture of time treatment. In my opinion, the faster you can get this under control, the better the outcome is going to be. I am not a fan of sitting and waiting. There are some families who choose to pursue something called IVIG. So literature says it has shown a 65% improvement in OCD symptoms in kids. if a family's interested in this, I'll definitely support them. I have seen some kids for whom this was an absolute game changer. I have seen other kids that it was not a great, it was just not a great approach. And in fact, it brought some issues in terms of maybe some regression. Sometimes tonsillectomy and adenoidectomy is the right thing to do. That's a pretty traditional approach. The thing about having a kid's tonsils out, God gave us tonsils for a reason, right? They're lymphoid tissue, they're immune system tissue, as are the adenoids. And I have seen many kids who improve when they have tonsils and adenoids removed. The thing about this, especially with the tonsils, the surgeon needs to understand the nature of pandas, because if any piece of that tonsillar stalk is left and not removed, then it's not really going to be as helpful as it should be. So we really need the surgeon to understand what we're dealing with. So if we're dealing with a virus, generally the traditional treatment is an antiviral like Valtrex. If it's a mold or a yeast issue, then the common treatment is an antifungal like diflucan. In terms of kind of how I approach this, many families are advised to start with a Motrin and a Benadryl protocol. I advocate, of course, the natural equivalents to those things. And this is really, really helpful because the natural anti-inflammatory is going to cool the encephalitis, right? It's going to cool off that brain on fire, and it's going to quell this immune system overreaction. And so we generally see a really nice improvement in kids right off the bat when we start with an antihistamine and an anti-inflammatory. I love using homeopathy for pandas. What we have to remember is we have to look at the long game when we're dealing with pandas. So we need something big, like an antibiotic, in the short term to get the symptoms under control, get behaviors under control, get the child feeling better, reduce the family's stress. And then we have to look long term at what got the child in this situation in the first place. What made their body susceptible to this infection that took over and changed the family's life? And so we have to look at things like deficiencies and mitochondrial support and long-term immune system stabilization. And that's what homeopathy really does, is it helps us play that long game to stabilize the immune system response and have resolution of this infection completely. I really like homeopathy for many reasons. It's very effective. It's gentle. And because different formats are available, it makes giving it to kids easier. So sometimes you can get it in a pellet. Sometimes it's a liquid. Sometimes it's a spray. And so all of those things really make it easier for kids to tolerate. Herbs are also quite effective. My three favorites are Cryptolepis, Redroot, and Chinese skullcap. All of these are very good antibacterials. They're also very good anti-inflammatories as well. So in terms of what to expect, parents always say to me, is this a forever thing? Will my kid ever be the same? And generally what I say is absolutely, but you have to look at it as a marathon and not a sprint. With the right approach, we can see that improvement can definitely be fast in some kids. But actually, most commonly, and what I really try to prepare parents for, is that often it takes some time to calm the inflammation and see changes. Patients receiving early intervention have much better outcomes than patients who are treated later from the onset. And we have to remember that part of this situation, of this diagnosis, is the relapsing and the remitting course. We call them flares, right? So kids are better and then they get worse and then they get better and worse. And so what I like to do. I don't like to function under duress, right? So I like to help parents prepare for the flares, know that they're coming, have some tools in their toolbox so that, if they get a wiggly tooth on a Friday night at 6 p.m., right, and no doctor's available, no urgent care is going to understand their situation, they have tools in their toolbox to help get them through and get that child stable. We always have to kind of just hold our breath until all baby teeth fall out and all adult teeth come in, because that is such a major flare. And again, working that long game, understanding why the child was susceptible in the first place and fixing those issues that's very, very important. So there is some controversy around PANS and PANDAS. And if you're a parent of a child who has this diagnosis or who you suspect this diagnosis in, you've probably discovered some of this. So there are many practitioners out there who will dispute whether PANS and PANDAS is a real thing. There is stacks of articles in the literature about PANS and PANDAS, so I'm not really sure, how you can say something isn't a real thing, but it's something that, we hear really, really frequently. And so because of this, either, because practitioners don't think it's real, or simply because of a lack of education, families have a very difficult time finding a practitioner who's able and willing to help them. And so the other thing that we'll see too is that if a practitioner is literate in PANS and PANDAS, they may follow a very strict model in terms of the diagnostic criteria. And if they're acute enough, or if, the symptoms aren't severe enough, then they will dismiss PANS and PANDAS as a possibility. So we really just need much more experienced doctors. And so that's why I'm here. So multiple diagnoses in a child. If any child has a red flag to their practitioner, and they really should consider a PANS and PANDAS workup. And so one of the logos and the themes that we have in my practice is the why matters. And it's really important that we understand what's happening with a child and figuring out the root cause of their behavior. Once we can figure out exactly what is happening with them, then we can, right? It's not just a Band-Aid. We're bringing long-term resolution to whatever their issue is. So really understanding that the why matters and uncovering those deep-seated issues that are causing the issues is very important. So if you want more information about PANS and PANDAS, here are some really nice resources for you. The PANDAS Network, the PANDAS Physicians Network as well, give you some really nice information, whether you're a parent or a professional. And if you want more information specifically from me, this is my contact information. Our clinic is in Jefferson City, Missouri, but we do offer telehealth visits if we're too far away. And so we're definitely happy to help with any questions you might have. If you'd like to establish as a new patient, we're always taking new patients. We actually do have an offer for those of you who participated in the webinar today. You can schedule a new patient consultation with me, either an office visit or a telehealth visit at a discount. So we're offering about $75 off of that initial consultation. So if you are interested in that and would like to schedule, you can call the number on the screen and we will definitely honor that. You can make this purchase directly from the link that you see on your screen as well. So if you have any questions at all, please feel free to email me. And also stay tuned. On April 7th, our next webinar is talking about low cholesterol and why you need to care about that if you have a child with complex needs. So thank you so much for attending. And please, I'm happy to answer any questions that that you might have if you would like to email me. I do have a comment that says from Casey that you'd like to set up a visit. Absolutely. We would be more than happy to help you. There is a slight waiting list, just so you know, Casey, but we'll do our absolute best to get you and your child in as soon as possible. And Michael asks, will the PowerPoint be available? Happy to email that to all the people who registered. If you're interested in that, we're more than happy to do that. There will be a replay available as well, so everyone who registered can access the replay at any time. Casey, so happy, yeah, that you're on, and I look forward to meeting you and your child as well. We do have a few minutes, so if you would like to drop any questions in the chat box, I'll hang on just for a few more minutes to see if anyone is having any other questions. Don't forget, this is a, oh, Elisa, thank you. She says, Dr. McGowan and staff are amazing. We appreciate that. So I am offering monthly webinars. So on the first Friday of each month, we will be hosting a webinar. As I mentioned, in April is low cholesterol. And in May, I'll be talking about the 5 supplements that you should consider for a complex kid. I'll be talking about sort of how I figure out what kids need, what labs I do, what sort of physical symptoms show me the way in terms of what a child needs. So we'll be talking about 5 different supplements that I think most kids with complex needs would benefit from. All right, so Brittany asks, if a mom tested positive for Group B strep before delivery, is this an increased risk for a child to develop PANDAS? So that is a really good question, Brittany. So the literature does not really talk about this, but in my mind, if mom had Group B strep during pregnancy and delivery, I always check kids for PANDAS, always. So that was really smart of you to put that together. So yes, I definitely have found a correlation clinically in my own practice. Catherine asks, do ticks show up following flu shots, etc.? So yes, any sort of insult or shock to the immune system can cause an onset of symptoms. So I see kids who might have some sort of vaccine, and then we will have an onset of symptoms. Sometimes I've even had families who say someone in their family got a vaccine and then child had an onset of symptoms. So there seems to be some shedding with some particular shots around that. So yeah, any sort of immune system challenge can cause an onset of symptoms. Maria says, I just attended the ILADS conference in Pennsylvania. They suggested that the Cunningham panel is better during an acute flare. Do you find that some labs are better than others for distinguishing which organism is responsible for the PANS? Well, I love that you went to the ILADS conference. So the Cunningham panel is sort of the first line that most doctors look at. I think it's an excellent test. I do, however, think it's a little bit expensive for what you get. No offense. I find that I'm really liking the Neural Zoomer from Vibrant America because it gives some pathogens as well as some antibodies. So it gives a lot more information for less money. I really just tend to start with blood work, as I lined out earlier in the slides, and then I kind of just target it down from there. If I'm pretty sure that we're looking at PANS or PANDAS, sometimes I'll go right for that Neural Zoomer. I love the Neural Zoomer too because you can get that on a blood spot. And if you've got kids, you know a blood draw is not always easy for them. So those are kind of my favorites. Jody, hi Jody. How long do you use the treatments for? For example, how long of a course of antibiotics versus herbals? You know, I really base it on the child. The literature says kind of best practice is a 3-week course of antibiotics with a potential 3-week refill. That's kind of the standard. It really just depends on if the pediatrician is up for that. Sometimes most pediatricians don't understand PANS and PANDAS. It's not their own fault. It's just not on their radar. And so it really, I tailor it based on the child. I keep in really close contact with the family, and we, we work on doses depending on how the child is coming along. Lauren says, traveling to Florida and don't want allergies to be a trigger. Can we use OTC allergy meds as a preventative? Do you recommend Claritin, Zyrtec, or any specific brand? So it's outside of the scope of my practice to recommend a specific over-the-counter medication, but there are many homeopathic allergy and antihistamine meds that, they're homeopathic remedies that I like. There are, BioResources carries a line called Picana, and they are liquid remedies. And there are a couple that are fantastic for allergy symptoms. And I like your idea of using them as a preventative. And so, Lauren, if you will email me, I will get you the names of those. I can't think of them off the top of my head. Michael asks, when will the replay be available? It should be ready by tomorrow, as far as I know. Any other questions? Let's see. So Jamie, hi Jamie, says, have you had patients only need to do homeopathy initially and never flare again? Yes. So sometimes what will happen is I'll get a little spider sense about, I think we need to check labs for strep. Not necessarily because it is a symptomatic presentation, but just because I've done this a long time and sometimes I just get an intuition about it. And we will find positive strep antibodies, but we don't really have supporting symptoms. In my opinion, those are kids who sort of have their feet on the path, and with the right, immune system challenge, we might kind of tip it over into a PANDAS situation. And so what I'll do is use homeopathy against that strep pathogen, and generally it puts it to bed, and we don't tip over into a PANDAS diagnosis. And yeah, there we go. Okay. Any other questions? We've got just a few minutes left on our timer. If you have any other questions, I'm happy to answer those for you. You guys have been a great audience. I really appreciate it. Oh, another question. Here we go. Are there dairy and corn-free homeopathics? Yes, absolutely there are. Yes. And I'm assuming you have a child who is sensitive to dairy and corn. So we can absolutely, anaphylactic to dairy. Yeah. So you would just want to make sure, that you source that very carefully and make sure your practitioner understands the dairy situation. Do I treat Asperger's adults? So I do accept patients who are adults. Generally I'm primarily a pediatrics practice, but when it comes to complex kids, there eventually will become complex adults. And so I'm happy to work with folks who are a little bit older who need my support. I also do a lot of work with adults who are having issues with, things like hormones, kind of chronic fatigue issues. So as long as you've got kind of a complex need, maybe a square peg in a round hole kind of situation, yes, I'm happy to accept you as a patient. Michael says your child will be 17 in July. Absolutely. Happy to take them on at that age. Yeah, no problems at all. It's been 6+ years for your child and you're at a loss. I can only imagine how stressful that has been, looking for answers for years on end. And sadly, a lot of the patients who come to me are exactly saying what you've said, that they've looked all over, they know something's wrong, but they just can't find the right provider to help them, down this road. And so that's kind of our jam. It's what we do really well at our clinic, is listening to parents, believing you when you say something isn't right, and just working together to get the diagnostics under control and figuring out what the pathogen is. I'm stubborn like a bull, so my husband says, and I hate not being able to figure things out. And so rather than give up, I usually just dig in a little harder. I don't know if that's my toxic trait or if that's a good thing. So Jamie says the prevalence of autism is off the charts. As we know, PANS pandas seems to be the same, though underdiagnosed. My son, as well as many others, are vaccine injured. Can you speak on those that are vaccine injured having immune system dysfunction and the tie to PANS pandas? So any sort of injury, vaccine injury or otherwise, is going to make a child more susceptible to further insults, right? So you have to be really careful about, what else you put into their system. You have to be really cognizant of what other sort of insults might be coming down the pike. And so, you're exactly right that a lot of times kids who have that sort of injury have pretty significant immune system dysfunction, and it really does set the stage for other things to show up, like PANS or pandas. Casey says, is PANDAS something that can go away completely, or will they always have it? We've got a lot of really nice success stories in our clinic. What I generally see is kids will flare, right? It's part of the deal. So that relapsing and remitting course, generally until about puberty. And it seems like if we can get the kid through puberty, then things really start to settle down. Now, that is not the case for every kid. Sometimes puberty is what incites part of the susceptibility. And so it's different for every kid, but I love to say that in the vast majority of my patients, we do see resolution as they get older. Other questions? You guys have really, really good questions and comments. Anything else I can answer for you? We do still have a couple minutes left. So don't forget, if you would like to establish as a new patient, there is a special offer for you. You can access that right here inside the webinar. If you'd rather not do it right there, you can call the office and let them know that you're a webinar registrant and that you're entitled to that particular discount. Don't forget, we do have a little bit of a waiting list, but Diane will get you taken care of when she answers the phone, and we'll get you in just as soon as we possibly can. All right, last call for questions before I let you guys get on with your day. Happy to send the PowerPoint slides to you when it's all over. And don't forget, you'll also have the replay that you can come back to. Do not forget that we have our webinar on total cholesterol on next Friday the 7th, a week from Friday. So Michael, yes, please, the PowerPoint. Yeah, I'm a visual person too. Yeah, I'd much rather just read the paper than watch a video. So, all right, guys. Well, thank you very, very much. If there's anything I can do for you, please feel free to email me, Dr. Sonia at covenantwellness.net, and keep your eyes and ears out for our future webinars, and be sure to register for those. That way you can access the replay. Thank you so much. Well, you're welcome. I'm really happy to be here. And if you have other topics that you're interested in learning about, feel free to drop them in the comments here or email me, because I'm glad to do that at any point. All right, guys, thank you so much. I appreciate your time today, and I look forward to hopefully meeting some of you in person. Have a good day.